Hello, this is Dr. Heilig. I'm going to do a presentation on shoulder replacement. I work with Assured Orthopedics of Kentucky. Some of the common indications for shoulder replacement include osteoarthritis, which is the most common form of arthritis, typically due to wear and tear, rheumatoid arthritis, deformity, post-traumatic arthritis, so arthritis that develops in the shoulder after an injury in the past. Revision would be another possibility if you have a shoulder that's either loosened or developed a fracture or just worn out. You can go in and put in a new shoulder or replace the parts that need it. Things to expect before surgery. It's nothing to eat or drink for 8 hours before surgery to prevent any complications with anesthesia. Plan on assist devices for 3 months minimum, this being a brace. My patients typically wake up with a shoulder brace that they need to wear 24/7 for the first couple of weeks. Good nutrition is important. This helps with the healing process, helps prevent any kind of wound complications. Avoid smoking. Recommendation is no smoking for 6 weeks before surgery and 3 months after surgery. This will help ensure that the new shoulder that the bone grows into the new shoulder. It also helps prevent wound complications such as poor healing or wound breakdown. Risks of a shoulder replacement include infection, fracture, both during and after surgery. Sometimes they can develop after surgery, loosening. The components can become loose over time with use, wear and tear. Persistent pain. Some patients, or most patients, will agree that the shoulder feels better than it did before surgery, but some patients will still have some continued pain in the shoulder. Stiffness. Therapy is very important after a shoulder replacement to help avoid this complication or make it as minimal as possible. Wound complications, like I mentioned, you can have wound breakdown or poor healing of the wound. After surgery, it's important to follow your surgeon's instructions closely. There is a failure rate reported up as high as 10% after shoulder replacement. You do want to use that brace. Like I mentioned, I usually will use it 24/7 for the first couple weeks and then back off to wearing it as needed, typically at night, to prevent you from doing anything in your sleep that could affect the shoulder as it's trying to heal. Shouldn't plan on driving for at least those first 2 weeks because once again, you're going to be in the brace 24/7 and trying to drive one-handed would be dangerous. No lifting, pulling, pushing with that arm. The brace is a good reminder to avoid those activities. Blood thinners. Some surgeons will have you on aspirin or some sort of blood thinner for about a month after surgery to prevent blood clot. Blood clot in the arm is not isn't considered to be as dangerous as in the leg, but it's still a possibility after a shoulder replacement. This is a painful procedure. We do everything we can to make it as comfortable as possible. Anesthesia will do a block where they numb up the arm. This lasts for about 12 to 24 hours. Typically do a scheduled anti-inflammatory with acetaminophen for breakthrough pain. And then there will be some kind of narcotic pain medication to take as needed for breakthrough pain. The brace is helpful in helping control the pain. It protects it and keeps you from doing things you shouldn't. Icing is very important. You want to do that as much as possible, at least for the first 3 to 5 days. I use a cryo cuff, which is a unit that'll run cold water about the shoulder. Helps with the pain and the swelling. Physical therapy is extremely important after a shoulder replacement. Usually we'll start some gentle passive range of motion and pendulum exercises the first day after surgery, where you can just swing your arm in a circle as it hangs down. Usually start formal physical therapy about 2 to 3 weeks after surgery. They'll start out with some passive motion where they just move the arm and you relax it. They'll progress to active motion in about 6 weeks where you're moving the arm yourself with your own muscles. And then strengthening at about 10 to 12 weeks. They'll use some bands and weights, typically about just 1 or 2 pounds to start with, and building up over time. A lot of these shoulders are weak. They protect them for a long time before surgery because they hurt too much to move and they lose their muscle mass, and it takes a long time to get that back again. This completes this presentation on shoulder replacement. Do not hesitate to contact me at Assured Orthopedics of Kentucky if you have any questions. Thank you.